Good afternoon to all of you, and welcome to today's webinar, Building Vaccine Confidence, Childhood Vaccination in a Post-Pandemic World. I am Rim Busadan, and I'm a project manager at Families Canada. For those who may be joining Families Canada webinar for the first time, Families Canada is a national association of family support centers. Our members are community-level organizations who provide hubs of free services, programs, and resources to primarily low-income and disadvantaged families in communities across Canada. Through our 500+ members, we impact the lives of approximately 500,000 families per year. For nearly 50 years, we have helped our members meet the evolving and complex needs of families by piloting, adapting, and scaling evidence-based programming, by developing and disseminating evidence-informed resources, and by providing professional development opportunities. In our work, we partner with private, public, not-for-profit, and academic organizations to turn knowledge into practice. We recognize that a multi-sector approach is essential for addressing barriers and strengthening families. So before I hand things over to our presenter, please allow me a few minutes to provide some context to today's webinar and share why we think the topic is so important. It has been less than a year since the WHO downgraded the COVID-19 pandemic from an international health emergency to an ongoing health issue. And while we have now entered a period of business as usual, the COVID-19 pandemic will continue to have lingering effects for the foreseeable future, with vaccinations continuing to be as important as ever, especially as we enter the winter flu season. Evidence suggests that flu and other respiratory illnesses are expected to increase significantly in fall and winter of 2023. At the same time, the Canadian population is behind on routine vaccinations. To mitigate against the risk of a surge of illness and hospitalizations this fall/winter, intensive targeted vaccine promotion is necessary, starting as early as possible. So with funding from the Public Health Agency of Canada and in partnership with the Eastern Ontario Health Unit, Families Canada is working to increase the capacity of family support sector to support vaccine confidence among groups facing marginalization through a series of webinars discussing the most pressing vaccine-related topics. And now it's my pleasure to introduce today's speaker. So Dr. Paul Remiliotis, aka Dr. Paul, has been the Medical Officer of Health and Chief Executive Officer of the Eastern Ontario Health Unit since January 2007. He is Vice Chair of the Council of Ontario Medical Officers of Health, past president of the Association of Local Public Health Agency, and currently sits on several provincial committees and boards, including the Ontario Provincial Council for Maternal and Child Health. I'm also pleased to say he is the chair of the board of Families Canada. Certified by the American Board of Pediatrics and the Royal College of Physicians of Canada, Dr. Paul received a first-class honors Bachelor's of Science degree in microbiology and immunology in 1979 and a medical degree in 1983 at McGill University. He is the founder and former director of the Montreal Children's Hospital Asthma and Pediatric Consultation Centers and Multi-Format Health Communications at McGill's Faculty of Medicine. He also holds a Master of Public Health degree from the Johns Hopkins School of Public Health, where he is an associate faculty member and is an adjunct professor at the School of Epidemiology and Public Health, the University of Ottawa. A passionate supporter of early childhood development through the life course and social determinants of health lens, he believes that public health is what community collectively does to ensure the health and wellness of its population. Dr. Paul, over to you.
Thank you very much. Thank you very much, Rim, and it's my pleasure to be here. Welcome everybody from across Canada. This is an important issue. This is something that I, as a pediatrician and public health leader, have been talking about since I started practicing back in the 80s, recognizing that vaccines have been probably one of the most important advances in medicine over the last century. and I'll show you later some of the impacts. So, pre-pandemic, I was doing a lot of these similar lectures to parenting groups, healthcare providers, trying to address some vaccine hesitancy and answering people's questions to maintain a high uptake of the vaccinations. And the pandemic happened, and as you'll see later, there were a lot of what I call negative outcomes or unwanted consequences of the restrictions and the closures. And so we are now faced with a problem of maybe a resurgence of hesitancy. I wouldn't say resurgence, perhaps an amplification of vaccine hesitancy post-pandemic. And again, with the COVID vaccination, as you know, we're now on our 6th dose, and so I think a lot of people are also fatigued about it. But it does not take away at all the importance of childhood vaccination. Whether we're in the post-pandemic world or pre-pandemic world, the only issue is right now is we need to sort of get back on track on some of the issues. And I know that Families Canada supports family centers, resource centers across Canada, and particularly marginalized, impoverished populations, newcomers, and so on. And unfortunately, with any issue, be it seeking medical care, access to vaccination, access to a doctor, and even rates of infections and so on are disproportionately on the negative side among these populations. So it's quite important that we recognize that particularly populations that are vulnerable need more support. And I think the family resource centers can play an important role in supporting them in not only vaccination but other issues. But I will limit it to the vaccinations and what family resource staff can do to help promote and foster increased uptake and understanding of vaccinations. So I'm just going to briefly give you a very quick overview of how vaccinations work and some of the practical stuff. So basically what vaccinations do is, we have an immune system, and ordinarily, let's say a germ comes into our immune system, be it a bacteria or a virus, our immune system reacts to it. And then within a couple of days, we're able to fight the infection. Unfortunately, in a lot of situations, these bacteria and these viruses are quite dangerous, and by the time we build up our immunity to that natural infection, it's too late. They cause severe disease, they cause death, and they cause all kinds of other consequences depending on the virus. And so what vaccines are basically preparations of parts of the vaccine, parts of the bacteria or virus or the germ that we want to protect that are injected or given by mouth. But I'll talk about the injections because they're the most common ones. And they're injected into our body, and they actually trick our body into thinking that we have the infection. Whereas we don't have the infection. And so then we have antibodies, and our immune system has a memory now. And then the next time we're confronted by that germ, the virus or bacteria, whatever it is, either it won't infect us at all, or in the best case scenario, or what will happen is that it may infect us, but because we have memory from our immune system, the bacteria or virus will be very quickly controlled and not cause severe disease or death. And COVID is an excellent example of that. COVID vaccinations, initially were preventing infection, and then with all the changes and mutations. But what we saw with the COVID vaccine is that it actually reduced the severity, particularly in vulnerable populations, which were the elderly. And as soon as we started vaccinating, we saw a decrease in death rates, decrease in hospitalizations, decrease in outbreaks. And so to me, that's how the vaccines work. And it depends on the vaccine. Some vaccines, you give in terms of duration of protection, some of them you give once or twice and you're good for life, like measles, for example. You get 1 or 2 boosters and you're good. Other vaccines you need to give every couple of years, and certainly the pediatric vaccines, we know that you need to give them initially at 2 months, 4 months, 6 months, 12 months, and then 18 months, and then boosters perhaps every 10 years. And adults don't realize sometimes that they need to get their diphtheria, tetanus, vaccine every 10 years. And as we get older, there are different types of vaccines that are given depending on the age group. So it's important that we understand how they work, and it's also important to understand and see how they've worked. So next slide, please. So this is really to give you an example. This is an older slide that I use, but it gives you a very visual picture of how vaccinations have diminished and virtually wiped out certain diseases and or significantly decreased them. So polio has been eradicated. We don't have any cases of polio. You could see before vaccines and after vaccines, the numbers. And so we are really lucky to have these vaccines, because all of these diseases, polio, diphtheria, rubella, German measles, Haemophilus influenza B, I'll talk a bit about that a bit later, pertussis, whooping cough, measles, all these are potentially very dangerous, particularly to young children. And so if the vaccinations can prevent severe disease, and by far, this is why I put it up here, the vaccines are one of the greatest advances that we have in medicine. So this, I talked about Haemophilus influenza B, and I talk about that because I've personally experienced this. Haemophilus influenza B, not to be confused with the influenza virus. Haemophilus influenza B, or HIB, is a bacteria that back when I was starting to practice pediatrics in the 1980s, early 1980s, we saw Haemophilus influenza B, I would say at the Montreal Children's Hospital, maybe 20, 30 cases a week, many of which were meningitis, epiglottitis, children were choking, heart infections, joint infections, severe infections that left a lot of scars. And unfortunately, we had a couple of children that succumbed to this disease. And so in 1985, and I remember very well, because that's a year that I saw a child who succumbed to Haemophilus influenza B a couple of days later at the hospital. Literally a month later, there was a vaccine that came out against this bacteria. And in those days, most of the cases were in children less than 2 years of age. And so, however, the initial vaccine was tested and more effective in older children. We started vaccinating the older children, and around 86, 87, we started seeing a decrease across all age groups, because what was happening is that the older children were vaccinated, were protected, and were not bringing it home and exposing their younger siblings. And so that's important. And then what happened was we started to get another form of the vaccine, which was more effective at 2 months, 4 months, 6 months of age, in children less than 2 years of age. And as you can see, as the years go by, into 1994, there was a drastic decrease in the cases. And today we hardly see this disease. And very often when I teach medical students and residents, they have never seen this. But this is a historical pattern that I witnessed, and my colleagues have witnessed, that we were working with, which was this was a horrible disease. And thankfully, we now have a vaccine that prevents it. And that's part of the routine vaccinations that are given in the first year and a half of life. So this is just a very quick chart of some of the vaccinations that are given. Like I told you, 2 months, 4 months, 6 months, 12 months, 18 months. I'm not going to go through details. They're available on multiple websites, Public Health Agency of Canada, and they may vary from province to province. But this is what we're really protecting: diphtheria, tetanus, polio, HIB, pneumococcus, which is again another bacteria that is very dangerous, and meningitis, meningococcal vaccinations. These are the ones that are given in the first couple of months, and then you could see as we progress. And as I said before, you need your booster at 5 years of age, and then we also have in the schools we go in and give HPV vaccination, which prevents cancer. That's very important, cervical cancer and other cancers in males as well, and hepatitis B vaccine. We also go into the schools to provide a meningococcal vaccine as well. And then, as I said, we have a booster, and then every 10 years after, every 10 years, we recommend, even to adults, to be getting their diphtheria tetanus booster. So this is in Ontario. I know we have people that are not from Ontario, but just to give you an example, in Ontario, we have what's called the Immunization Students Pupil Act that requires parents to provide proof of immunization. They do get an exemption, but they have to have certain documents and certain procedures to be able to be exempt. It could be a medical or it could be a belief. That's a minority of children, but however, we want children to have proof of vaccination for diphtheria, all the diseases that I talked to you about, including chickenpox, before they go to school, and that's the role that public health units play. Every year we collect the records and issue letters to parents to remind them to get their child up to date or to show us proof of vaccination. In the worst case scenario, we suspend them until they get vaccinated, but that's very rare. So just to give you an idea of how important we feel that this is, because it protects children in school, and then we also want to know which child is not vaccinated. For example, say a child can't be vaccinated for a certain disease like measles because of a medical issue, a medical contraindication. We need to know that that child is not vaccinated. Let's say there's an outbreak at school. We would ask the child to stay home until the outbreak is over, just to protect the child. I want to talk a bit about influenza. If you notice on the agenda, and sort of what we were talking about, the importance of vaccinations is not only are we looking at the COVID vaccinations that I talked about, but I'm also looking at the regular routine vaccinations. But we also have influenza, which is a yearly vaccine, and this one here is a special one because we need to vaccinate every year because the influenza virus that circulates every year changes. So last year's vaccine will not work against this year's version of the virus that keeps to be circulating. So I just want to remind people what happened last year. And I know you're hearing a lot about China, what's happening in China. Well, but what's happening in China now happened to us last year. So let me put that into context. Last year was the first fall or winter that we went into where we had removed all restrictions, all public health restrictions, distancing, mask, all that was removed. And so what happened was a lot of the viruses that were actually prevented, not only COVID, but also the respiratory viruses, influenza, RSV, all those viruses were prevented by our measures. All of a sudden, we removed the measures, and a lot of people had not been exposed to these before, and we got a big surge of infection, particularly among young children, and that's very important. So what we could see here is last year, around this time, we had peaked. We had peaked at almost a 30% positivity. Just to give you context, this time of year, and we are now, the positivity is around 5-6%, and that's where we are now. And this dot, the black dot, shows you on the top left-hand corner, it shows you the typical pattern pre-pandemic of that. But the blue peak that you see between 43 and 49 weeks is the influenza that really overwhelmed the system. And what happened was we also had an RSV surge at the same time, and that really disproportionately affected young children. If you look at the lower left curve, you can see that the orange line and the sort of dark brown line have the highest rates of admission, and the orange line is 65 plus. But look at the line that was almost just as high, quite much higher than the average, the overall rate, and that was children less than 5 years of age. And that's very important. And people don't understand that influenza not only affects the elderly and people with underlying medical conditions, but also young children. It's very important. And last year we had 9 deaths in Canada due to influenza. And so when you look at the figure 9 here, which is the number of pediatric hospitalizations reported by week, you can see again a tremendous increase. The blue sharp increase represents the number of admissions to hospital last year. And ordinarily at this time of year, you had maybe 5 admissions, and we're up to like 250 admissions. And that is what happened last year. And this is what's happening, by the way, in China. Right now, we're seeing a lot of children, because they removed this is their first year without restrictions. And so they're seeing this pattern as well, with a common, not only with influenza, but other RSV and other common respiratory viruses that are circulating this time of year. It's not a new pandemic or anything like that. We're keeping an eye on that. It just seems to be repeating what happened to us last year. This year, fortunately, we're looking at a more seasonal, a typical season. So we are seeing the influenza go up a bit, but not to the extent that it went last year, and it's gonna and it's following the typical pre-pandemic pattern. So I think these viruses have kind of reset themselves. But the bottom line is that we need to protect everybody against influenza, and particularly when you're dealing with families, it's important to remind them that the parents themselves, the grandparents, and so on, but particularly young children, need to be vaccinated against influenza, and that people don't understand that, and we have very low rates of influenza uptake vaccine among young children, and that's something that we're trying to work on with a lot of education, a lot of trying to make people aware. People don't seem to think that the flu is dangerous to young children, but on the contrary, and sadly, it is. And again, this goes to show you, this slide just showed you the influenza vaccination rates. And so we're barely the majority is 40%. And even in seniors, we're looking at 70%. Ideally, we need to be about 80% for seniors and a bit higher for everybody else. And obviously for young children, the numbers are even lower. I would say in my area, probably 5, 10, 15%. We need to get it that a bit higher because, like I said, because the influenza does infect young children as well. And so when dealing with families, and again, you could see that it's the two ends of the spectrum, younger children and seniors. And so when you're dealing with families, multi-generational families, it's important that everybody gets protected. Now, what we've been seeing as well, and this is just data that we have now only over the last 2021, is a decrease, and I don't have the data nationally, but I can tell you that locally we have the same experience. We're seeing, if you compare pre-pandemic to post-pandemic, we're seeing a less uptake in terms of percentage of kids vaccinated against the routine vaccines, diphtheria, polio, HIV, measles. It tends to be lower across the board. And that's really what what we talked about at the beginning of the pandemic fallout of vaccine coverage, which will have its implications. But again, this goes to show you that there is, and that trend, it has continued in 2022 and in 2023, where we have lower uptake, and that's something important. That's something that's challenging us. And again, another potential important role for family resource centers across Canada. So this is the post-pandemic reality. And what we're seeing is, this is the World Health Organization that talks about immediate and targeted catch-up is required to avert measles resurgence. And so I can tell you that I was just listening to the news this morning. There's a measles case that traveled to Alberta on an airplane. And all these people now have been called back because it's very contagious. We have not had many measles cases in Canada, and most of the measles cases that we've had have come from people traveling and themselves were not vaccinated. And so we want to make sure that we catch up in the vaccinations. I also saw in other parts of the world where diphtheria is starting to increase because of the lack of appropriate vaccination for these children. And so we need to be aware that it's vital for us to catch up. So why did we fall behind? It's intuitively logical. They fell behind in missed the routine vaccinations because we focused on COVID as a priority, but schools closed, clinics closed. There was there's really no primary care. Everything stopped, if you recall, in the first year and a half of the pandemic. And so we did fall behind. We're busy catching up, and I will talk about that. But all of these things, like I said, the focus on COVID, taking our resources for other COVID-related activities, looking at case and contact management, and all these things took away from the ability of public health and other organizations who ordinarily vaccinate to vaccinate, because we had to switch all our resources to COVID-related activities. School closures as well, particularly for the vaccines that we give in grade 7, meningococcal, HPV vaccine, and hepatitis vaccine. And, as you've heard with COVID, there was a lot of growing vaccine hesitancy, all these theories, skepticism, a lot of vaccine misinformation during the pandemic occurred. And unfortunately, that has spilt over and probably influenced people who had some hesitancy and maybe that increased their hesitancy. So it's quite important for us to recognize that. So what we're doing right now really is there are a lot of efforts collectively across Canada to increase opportunities, increase clinics, to be able to vaccinate. I know now that some pharmacists are able to vaccinate, give some of the pediatric vaccinations and so on. So those are the type of things we're doing at the health unit, working with primary care providers, going into schools, offering after school programs, offering weekend programs, after hour programs, really trying to catch up, identifying and removing barriers. Sometimes it may be that they're working. So then we'll do a night clinic. There might be other issues. They don't have transportation. It may be hesitancy, and I'll talk a bit about that later on the next slide. We're doing a lot of awareness campaigns just to make sure people understand, and we're trying to remove all obstacles from that. And I call it an all hands on deck approach. And what does that mean? That means exactly what it means. It's everybody's role. I think people have the opportunities to be able to inform parents, inform families about that, and remind them about the vaccines. And again, this is in the context of family resources across Canada, that you're positioned very well to be able to remind parents about that, identify perhaps barriers. They might not know. There might be newcomers. They may not know where to get the vaccine. Though all the type of things that you can do once you move to talk a bit about that. When you're dealing with those families, particularly, again, not only talking about routine vaccines, but also when you're talking about seasonal vaccines like influenza, for example. So, yeah, like I said, the family service providers have a real important role. You're uniquely positioned to reach and encourage families to get their kids caught up, or to start the vaccines, or to get their flu vaccine, and especially vulnerable populations that can be harder to reach with traditional campaigns and have perhaps very different barriers, different challenges, different reasons for not being vaccinated, and so on, which you can address. And as you know, the families, you're the best position to be able to understand some of the questions and so on. And sometimes it would be, like I said, simple. Just say, oh yeah, by the way, clinic next door is offering vaccines and so on. But it may be a bit more entrenched in vaccine hesitancy, and the next slide will address that. But like I said, I think you're trusted advisors, and you can help share information with families as you have the direct contact and relationships with these families. And it's very important. And as you'll see in the next slide, that trusting relationship goes a long way in being able to convince somebody to get their child vaccinated, or to remind them to getting vaccinated. So here are some tips for addressing hesitancy. And again, this is everybody's role, anybody that's dealing with them, or maybe the topic comes up. I think the first thing I want to say is that we know that about 10 to 15% of the population is hesitant, which means that they have questions, they're not sure. They may have been influenced by all the COVID vaccine fallout and so on. But in real life, and this was pre-pandemic, we had done some studies, 1% of the population refuses vaccines categorically. So most people, the 10 to 15% within that, most of those people, I think once you have a trusting and open relationship with them, they will be able to be convinced to get their children vaccinated or restart their vaccinations. So I think it's important to, and again, I talk about this to primary care providers, pharmacists, anybody that's involved with children, or anybody that's going to be involved in vaccinating children. And so it's important to have that relationship, listen to them carefully, be an active listener, don't interrupt, don't blurt out your own opinions, but be understanding, and then address some of their concerns. For example, one of the most common myths is that vaccine cause autism. It's not true. It's been that myth has been dispelled many times scientifically. But in any other myth that they may have, like for example, the flu shot will give me the flu. No, that's not true, and so there are a few things that you can address right away. Be prepared to address any commonly circulating misinformation. They may come to you with an internet saying, oh, look what this study, and the studies it's not a valid scientifically based study. Though that's important. Be aware of the commonly circulating misinformation so you can address them very quickly. And don't be pushy. Be patient. It may take several encounters, and I think that's very important. And also, we also have to address co-vaccination, co-administration fears or anxiety. Some kids are, vaccine needle phobic and so on. More and more, we're giving a couple of vaccines at the same time, particularly younger babies, because it's two different shots given at the same encounter. So that's something we need to explain, and why it's safe and why you can do it, and it's also an opportunity not to miss an opportunity. And then finally, address any anxiety by the child. Is it needle phobia? Have they had past fainting? Is that the reason that the parents are anxious or the children are anxious? There's a couple of things we can do about needle phobia. We can there's some gels that you can put that freeze the skin. If the child has past fainting, syncope, then there are procedures that you can do, have them lie down, and so on. So those are the things that I think that are very important. But at bottom line is establishing a trusting and open relationship. That studies have shown that is the major factor that will influence parents and other caregivers to get their children vaccinated. And so again, the all hands on deck approach, remember that. Make it a habit to recommend for families to talk to their primary care provider, be it a family doctor, nurse practitioner, pediatrician, even a pharmacist, or their local public health agency, depending on where you are, to find out whether vaccines are needed or up to date. Again, reminding them and maybe putting them in the right direction, but addressing their issues, because like I said, I think you are very well placed to be able to address all of those issues. So thank you very much. And again, just to remind you, vaccines, probably one of the most important advances in medicine over the last century, saving millions of lives. And just as an anecdote, we think that the COVID vaccines themselves have saved probably between 15 and 25 million lives. Thank you.